Welcome to our second event of the 4-part series of collective conversations. Today's event is focusing on identifying priorities for strengthening healthcare systems to better promote population wellness and to provide genuine care. This series is intended to create a space where we bring together academia with representatives from government, private sector, and civil society to start discussing and talking about the key developments that are expected in the next 5 to 10 years in the various sectors of the economy.
So health systems comprise of all the people who come together at the moment largely to deliver healthcare. And they could be people working in clinics or in hospitals, but they're also people who provide the funding to support the services, who manage the supply chain, who ensure that people are appropriately trained and skilled and qualified and so on. So there's a whole range of people. In addition, health systems include the people who we usually talk about as patients, but the broader communities that the health system serves. And in fact, academics like me, they're part of health systems too, not just because we use them, but because these things, health systems, as I said, are part of our society. So we're all part of the health system, if you like.
We have a growing incidence of communicable diseases like HIV, TB within the country, but alongside that we are seeing an increasing incidence of non-communicable diseases, observing an increase in diabetes, in cancer, and so we need a robust healthcare system that is able to manage and respond to those challenges.
So at this stage, we are at the space where most of our government departments, particularly organized by the health department, are saying let's co-create. Co-creation, we say that we sit down and do the mapping and identify the key resolutions that we think may be possible for our communities. But in that space, we're patiently waiting to see what does it mean in terms of the data transfer or interpretation after that, because we don't want to sit only on the tables and brainstorm. We want to see the translation of that at community level. By that I mean we need to see the data collection having change or indicating changes in terms of where we are now in terms of the pandemic or epidemic, to see where are we. We are calling our government to make sure that they consult also with communities, not only at provincial level, because people are in those hard-to-reach communities, in those informal settlements. So we are here representing communities that are asking us to make sure that we are understood by government and academia.
And we are looking at identifying priorities to strengthen healthcare systems. Strengthen healthcare systems in a way that promote equitable access to health services, in a way that improves the population wellness and health.
One of the key parts of UCT is teaching and training of health professionals. We host quite a lot of students from the health professional side on the platform from UCT, and actually over the years UCT has also done innovative stuff with us, like for instance introducing a rehab care worker, a mid-level worker that's not actually part of any curriculum. If we want to think from the perspective of the person that must benefit most from a health system, it is from the perspective of the patient, the person in their communities that are healthy but needs to remain to be healthy, and then the people in that community that actually are at risk of ill health. Therefore, from a well-being perspective, it is important for us to recognize that if we want societal well-being with communities that are well, so that individuals and families and units can be well, it's crucially important for us to talk about the paradigms that needs to be challenged to take us from a disease orientation to a person orientation, to take us from a biomedical model perspective to a psychosocial model perspective, and takes us ultimately from a programmatic perspective to a systems perspective. I'm making the case of why those things are so important.